Organizations of all types, even governments, need capital, financial assets to succeed. People and what they bring to the table are increasingly being seen as a form of capital, human capital, the stock of competencies, knowledge, social and personality attributes embodied in the ability to perform labor and produce economic value. But organizations and the country at large will not get the full value of Jamaica's human capital if the people are not healthy enough to perform. In addition to education and an effective public service, this fiscal year finds the government pursuing a number of policies and programs to strengthen the healthcare system as part of the strategic focus on human capital development.
The ministry will spearhead the protection of individual and population health through the promotion of healthy families. Indeed, healthy families are the pillars of a healthy nation.
Achieving this goal involves more efficient management of the healthcare system, boosting primary healthcare and installing more appropriate referral systems from primary to secondary or tertiary facilities. Many strategies are underway to ensure Jamaica's healthcare system is more effectively managed. Jamaica currently commits approximately 4.7% of its gross domestic product GDP to healthcare. The ideal is to raise that figure to about 10%. But financing healthcare is very expensive, which is why the administration has been hosting a series of public consultations to find suitable means of generating revenue to finance the public health sector. Up to August 2013, 8 consultation sessions had been held, providing a range of suggestions for public health financing. Another important gain was made recently when a single authority for sexual and reproductive health was created. It should preserve advancements already made and allow for sustainability of the national HIV program. This was achieved by integrating some aspects of that program with the National Family Planning Board.
The integrated organization will give effect to one of the key strategies outlined in Vision 2030, Jamaica National Development Plan, which is to expand and improve integration of family planning, maternal and child health, sexual and reproductive health, and HIV/AIDS into primary health care.
Meanwhile, a new level of service and experience in pharmacy service began as at August 2013. It's the start of a process to revolutionize the service, making it more technology-driven, customer-focused and efficiently managed, with 24-hour service extended in hospitals and some health centers. And on July 15, 2013, a ban was imposed on smoking in specified public places. It represents a major step towards curbing this public health threat and reaffirms government's commitment to upholding the right of all people to the highest standard of health. Consultations continue with various stakeholders for the effective implementation of the regulations. In the meantime, the Health Ministry is optimistic about the impact that the new policy will have on reducing premature deaths from non-communicable diseases, NCDs. Government expects to break ground very soon for the last of 4 centers of excellence, which represent best practice in terms of primary health care. The Portfolio Minister gave that update in July as he announced that work was far advanced on the other 3 centers, Isaac Barrett in St. Thomas, Darlington in Westmoreland, and Santa Cruz in St. Elizabeth. Their structures are being enhanced and, when completed, the facilities will be equipped with first-class medical equipment and additional health professionals. These will support upgrading works taking place on many other health centers across the island.
While we are working on the over 300 health centers in terms of upgrading not just the physical infrastructure, but the human resource infrastructure, the diagnostic response at primary level, and while that is happening, our secondary centers, hospitals, will not be neglected.
While work continues to improve the care offered at various hospitals, government is also implementing a seamless referral system for persons seeking treatment in the public health system. It involves ensuring that patients are properly referred to a health center or hospital depending on the nature of treatment needed. The referral system is being established to reduce unnecessary costs at the secondary and tertiary level while optimizing the use of resources and reduce waiting time at all levels. The Ministry of Health advancing the Human Development Goal by securing the health of individuals and, by extension, the nation.